Hello, everyone. Welcome. This presentation is about the association between depression and cardiac disease. Please note that this lecture is intended for general education purposes, and it is not intended to provide medical advice to any individual. If you have any questions or concerns at the end of this presentation, please let the individual in the front know, as well as reach out to the cardiac rehab program. All right, so you might be wondering, I'm here for cardiac rehab. Why am I learning about depression? What's important to know is research has found that depression is highly prevalent in cardiac patients. In fact, between 31 and 45% of patients with coronary artery disease, including those who have well-managed coronary artery disease on medication, seeing their doctor, etc., have endorsed significant depression symptoms. Additionally, 15 to 20% of patients with coronary artery disease have met full criteria of major depressive disorder or experience a major depressive episode. That means they meet all symptom criteria for depression. In addition to patients who have coronary artery disease, it's important to know that depression has also been found to be quite common in patients who have a history of a heart attack or MI. In fact, around 29 to 36% of individuals who have this history have been found to meet criteria or endorse significant depressive symptoms. In fact, in that data set that they were able to use, gender differences were found, where women reporting higher symptoms of depression versus men. So men range closer to the 29%, whereas 36 was closer to where women were. Okay, so as we build on this information, we know that patients who have a history of cardiac symptoms, MI, coronary artery disease, etc., they might experience higher rates of depression or report higher symptoms of depression. But understanding what depression looks like is going to be very important for not only you, but also for how much support you might need. Knowing what depression looks like, not only from maybe a textbook versus what you talk to your friends about, is going to vary. Movies tend to show it one way, books or textbooks talk about it the other, your friends or family might consider depression one thing, whereas your doctor may or may not talk about depression in an entirely different way. Likely they're all talking about similar symptoms, but what is likely changing between these two is how it's presented or displayed outside of oneself, in terms of how they act, how they might be feeling, or what they might be saying internally or externally. We'll talk a little bit more about the core symptoms of depression and how it might vary between individuals in the next few slides. So as you may have learned in our test questions earlier in this presentation, that there are two cardinal symptoms of depression. Now, it may look a little different how individuals portray these symptoms. However, at its core, depression is founded by a depressed mood and loss of pleasure in things you usually enjoy for most of the day, nearly every day for the last 2 weeks. Or for the 2-week period of time. What's important is when we see this depressed mood, low mood, not feeling good about things, kind of that emotional low, and the loss of pleasure in things that you usually enjoy, unable to gain happiness from your usual hobbies, or maybe spending time with your family doesn't really feel as good as it used to. It's important to start to pay attention. Of course, we always have to consider some medical causes, for example, ruling out things like hypothyroidism, which can also reduce sensitive mood as well as maybe pleasure in enjoying things because it will affect our bodily processes. So it's important to talk to your doctor as well as your family about some of these symptoms to ensure we rule out any medical causes before we really dive into learning more about depression and how we can treat it. In addition to the two core symptoms we just discussed, there are 7 additional symptoms that are common in depression. One is poor concentration. This might look like you struggle to attend or focus on things you usually do, like reading a book, you have to reread a lot more, or you're watching TV and you just can't really focus. You might also see a symptom such as feelings of worthlessness or guilt. This is a lot of focus on, I should have done this better, or I'm not really good, or I let someone else down. That sense of guilt is a symptom in itself. Sleep difficulties is an additional symptom, such as sleeping more than usual, hypersomnia, or insomnia, struggling to sleep. You might see appetite or weight change, so eating a lot more than usual or eating a lot less than usual. You might generally see a loss of energy or fatigue that's not otherwise explained by a medical condition or change in your routine. You might also experience something called psychomotor agitation or slowing. In real terms, this is becoming fidgety or restless, people noticing you're struggling to sit still, or opposite of that, you're starting to notice a lot more slowing of your movements. You're just slower emotionally and physically. And last but definitely not least, it is common for individuals who might experience depression, especially more moderate to severe cases, to experience suicidal thoughts. This is important to acknowledge because while it's not required for a diagnosis of depression, if this begins, it's important to get immediate attention and support. This might look like calling 911, going to the ER, or speaking to your mental health or physical health professional to make sure you're getting support and ensure that you're safe. In addition to the core symptoms of depression, we often see depression and anxiety coming together. So while they're not required to exist with one another, it is pretty common to see the symptoms overlap. I like to describe that anxiety and depression are kind of like best friends that are in for trouble. They want to encourage each other and make each other more intense or worse. So individuals who have a lot of depression and anxiety combined might see that they worry more often, and that's interfering with concentration and focus. They might have a sense of impending doom, that something awful might happen. Or they might just generally start worrying a little bit more about losing control. That might make them more tense or restless, which is again a symptom of depression. Rumination or uncontrolled thoughts or worry is also common, and they might be about things such as depression or your inability to maintain your energy or usual routine, also seen in depression. While depression symptoms are important for diagnosis and be able to track your severity or experiences with depression, I like to mention that how depression shows up in your life is going to look a little different. But for a lot of individuals, it might look like faulty or unhelpful beliefs. That might be the core symptom or sign you might see for yourself. This might look like thoughts such as, life is just awful, or I'm such an idiot. I let that stress get back to me, and now I'm smoking again. Or a general overwhelming sense of, wow, things are never going to get better. These are faulty and unhelpful beliefs that in therapy we can look at, observe, and process, and maybe help challenge, because a lot of times faulty and unhelpful beliefs are a sign of depression that encourages the depression to continue. It might encourage symptoms such as excessive guilt, or it might encourage you to lean on your low energy and say, I'm not going to go hang out with my friends anymore. Life is awful. So really, it's important to start noticing not only the physical symptoms of depression, as well as your thoughts or cognitive symptoms of depression. It's very important to know that depression can and will vary across individuals. This does not only mean the severity of symptoms, mild, moderate, or severe, but it also might mean what factors of life are happening, the context in which the depression symptoms occur, and how depression is displayed. It's a key question to ask yourself, as well as an important thing for your provider, such as a therapist or mental health professional, might ask is, how are these symptoms affecting your everyday functioning? You may meet criteria for depression, you may have several symptoms, but what's important to know is not only how severe they may be, but how impactful are they? Does it affect your ability to maintain your roles, such as going to work, hanging out with your family, spending time with their friends and loved ones? Does it change your ability to maintain or willingness to maintain hobbies or activities like exercise? Or does it affect things like self-care? Are you able to maintain routines you would like, or even down to the basics such as showering on the regular basis? It's important to know that functioning is a key part of depression, and if it is affecting your functioning, treatment and support is going to be important. It's important to understand your signs and symptoms of depression because not only it allows you to notice the severity of your symptoms and how it's impacting your functioning, but it's also important to know that if depression goes untreated, maybe it looks a little different for you or your neighbor, Regardless, if it goes untreated, there's going to be a difference in terms of how it affects your coronary artery disease or cardiac health. Studies have found that it can increase coronary artery disease to not have your depression treated, because that might increase, for example, someone's adherence to unhealthy diet or reduce exercise or willingness to socialize and get out of the house. This might also result in increased stress, which results in furthering the coronary artery disease risk factors. Additionally, we found that individuals who have depression and coronary artery disease also may find themselves taking their meds less often or be less adherent with medications or lifestyle changes. So it's very, very important to know that functioning is key, and one way that we might see that depression is affecting your functioning is if you are not following through with your coronary artery disease methods, requirements, medications, etc., etc. So you might be wondering, okay, so I know the signs and symptoms, I know it might vary between individuals, so I have to pay attention to not only my symptoms, but how is it affecting my functioning? So I don't want it to go untreated. What can I do? What are the options? So for many conditions, there are several options, and for depression especially, we have found a lot of evidence for not only psychotherapy, medication, but also a combination of psychotherapy and medication. In particular, CBT or cognitive behavioral therapy-based interventions, psychotherapy interventions, have been found to be significantly improving of symptoms of depression, as well as anxiety and stress for people who have coronary artery disease and congestive heart difficulties. Additional findings have shown that even patients with heart failure have found that CBT has improved depression and reduced depression symptomology or symptoms. Medication, there's several medications out on the market, particularly SSRIs that can, or selective serotonin reuptake inhibitors, which is a long way to say that it's a strong, significant way to treat depression in the brain. These medications are important and have been found to be very useful in combination with therapy, psychotherapy, or by themselves. The combination is important because if you find that one or the other is not helping as much as you'd like, you can look into combining them. So you might be wondering, especially if you have not participated in psychotherapy before, what is cognitive behavioral therapy or CBT? CBT is a very efficacious and well-studied psychotherapy approach that has been around for quite a while that is found to be incredibly helpful for those struggling with depression and other mental health conditions. Its basis is focused on us as humans having this very strong brain that likes to throw us problem-solving skills, it likes to throw us ideas, but it also likes to throw us worries and thinking patterns that might not be very helpful. Something that we've talked about earlier in this presentation is how depression can increase our negative thinking patterns, how we might perceive ourselves or our conditions or our context. What CBT does is examines and modifies these thinking patterns by prescribing and developing behavioral strategies, as well as better insight into how we might be thinking. On the slide here, you see a triangle. It's the CBT triangle, I like to call. And this includes the thoughts, feelings, and behaviors that make up this interaction that might result in increased depression symptoms or anxiety. But in this case, our depression symptoms can really increase when our thoughts are very negative, such as how we react to our changing abilities. I can't believe I can't do this anymore. I wish I could. Our feelings, which might react to, and that makes me feel very sad, very, very depressed, very hopeless. And so our behaviors follow that might be, I'm not going to go out anymore, or I'm going to sit on the couch because I don't think I can do what I used to. What happens is the CBT triangle ends up cycling into what I see as a negative downward spiral, which can increase the severity and risk factors of depression. If you want to learn more about CBT, at the bottom here is information about a book, a self-help book called Feeling Good by David Burns. He's a doctor. This is a self-help book and it's not a substitute for therapy, but if you'd like to learn more about CBT, this is a fabulous introduction and gives you a lot of skills if you want to go do that instead of psychotherapy itself. So CBT, one of the core tenets, is adjusting thinking patterns, building insight into our negative patterns and being able to challenge them. So I'm going to go through an example that might come up in treatment for depression using CBT and how a therapist might work with you to adjust and work on those thinking patterns to improve your well-being and increase your willingness to kind of push back on those depression symptoms. So first, we would work to identify and challenge your automatic thoughts. Everyone's going to have a different set of these, how often, how severe they might be, and what they look like. So let's say this example of an individual who's coming into cardiac rehab and wants to start cognitive behavioral therapy because they are unable to do what they used to after their cardiac arrest. They feel that their life is awful because I can't do what I used to do. That's an automatic negative thought. It's a pattern of thinking they've been seeing increase since their heart attack. What the therapist would do is not only identify, but also try to label that. What we would call that is something called catastrophizing. I would work to carefully and kindly challenge, is it true that your life is entirely awful? Or is there something you can still do? Are there things that you're able to do? You can both feel negative and frustrated about your heart attack, but does it mean everything is ruined? That's catastrophizing, making that mountain out of a molehill. We don't want to invalidate your experience, and that's really important to know that a therapist doing CBT is not aiming to invalidate through these challenging or identifying of your thoughts, but rather simply building the insight so you can then compose different reactions to those thoughts, and maybe over time reduce how often you have those thoughts. So for example, once we identify this might be catastrophizing, let's look at other ways you can react to this thought or this experience. Maybe I'm going to look at my priorities. What are my values? And I need to put energy into those things to ensure that my life is feeling at least aligned with what I want to be doing. That's a reaction, a composed reaction that is different than catastrophizing. Another option could be saying something like, what can I actually do now to problem solve? How do I keep moving forward? If I wasn't able to do what I'm used to do, what are things I can still do? Or how can I increase my cardiac ability so I can get back to what I used to? Let me talk to my doctor. Let me talk to my family. Maybe we can set up a new exercise routine. CBT helps you identify, challenge, and then compose a response, all with the willingness and awareness that this is hard, this is difficult, and depression symptoms are not something to be invalidated, but rather respected and understood. As CBT includes, there's the cognitive thinking patterns, but there's also the behavioral CBT, cognitive behavioral therapy. So behavioral interventions are also critical for cognitive behavioral therapy, as it not only follows the education and changing of your thought patterns to be more helpful and positive, to how do we encourage our body to move, our life to be filled with things that we might enjoy, so we can fight back against the depression that might be telling us to be less motivated or not be as active. This might look like planning out what are some activities you can do that really bring you joy or pleasure. These might be small things or really big things. It might be something called behavioral activation, which in short term is really just getting out, moving your body, and increasing the endorphins in your body. This might include exercise, it might include walking with family, it might include simply getting into your home and doing the chore you wanted to do for a long period of time, but you kept putting off. Behaviorally activating yourself is a big key part of behavioral intervention for depression. Last but not least is assertive communication. Setting boundaries. We might find that behavioral interventions doesn't have to be exercise. It could be exercising our boundaries or our choices, standing up for ourselves or asking for help. The assertive communication to say, hello, I'm struggling with depression. I would like some support. Or, hello, I'm struggling with how you are treating me. It will be helpful if we can communicate better in our relationship. Another example of a psychotherapy that can be helpful in terms of treating depression, among other mental health conditions, is something called acceptance and commitment therapy. While this is slightly newer than CBT, it is based on the same conditions that we are brain-filled human beings that like to solve problems and think through things. What's important about ACT is it approaches depression symptoms, among other conditions, from a different angle. What's important in ACT is their perspective is Sometimes when we have a negative thinking pattern or symptoms such as depression, we might try to avoid or control those negative experiences. We might try to stop or avoid our thoughts and feelings when we're feeling really down or distressed. Let's say a recent cardiac arrest or diagnosis of coronary artery disease might make you feel really scared and frustrated. It might make you feel like you can't do what you used to. ACT will approach this through a lens of psychological flexibility, meaning wanting to focus on what can you do in terms of long-term increasing of quality of life rather than focusing on try to control or avoid what you're feeling now. What happens is instead of being able to try to reduce our symptoms, fight back about what's going on, and feel really frustrated, you might take a step back and notice, what can I control? What ways can I increase my well-being and pivot away from the negative thinking patterns to be able to experience more positivity as well as more acceptance? A key tenet of acceptance and commitment therapy is acceptance of what we can and cannot control. We may not be able to go back in time and take back our heart attack, but what we can do is stay in the present now and accept what is going on and how can I problem solve and get through this. It's a very mindful present moment approach. The second part of commitment therapy is being able to accept what's going on and then commit to our values, being able to pivot towards those values, to be able to commit to a life that is increased in terms of well-being rather than focused on negativity in terms of symptom reduction or frustration. I'll give you an example what this looks like in the next slide. During an example of an ACT therapy session, you might find that you're struggling to accept your new diagnosis of coronary artery disease. You might find yourself frustrated a lot of times. You might be seeing increased symptoms of depression, low motivation, irritability, perhaps some anxiety and worry about your condition and what might happen in the future. Your motivation may be down, you're feeling quite low, maybe a little helpless, and things don't really feel as good as they used to. You're starting to notice, I'm having depression symptoms. What you might do is come into a therapy session when you do ACT and really use the experience in session, such as metaphors, or your therapist might ask you questions about what's happening right in the moment to better understand and accept those feelings. An important thing about ACT is it's never going to tell you you shouldn't or cannot feel those feelings. While they may be difficult and hard, rather than avoiding them, we want to feel them and understand them. On the slide here, you have on the left side those negative emotions, those symptoms. Sitting in an ACT therapy session might increase your insight and awareness that I'm feeling this and why. You might process with your therapist how you're feeling about these changes, what you might want to be doing, and how can you maybe reduce feeling stuck or frustrated and rather pivot towards something in your life that feels more wholesome or value-based. On the right side of the slide, it might look like going out more often in the nature or talking more with your friends and families, gardening more or other hobbies. It might just simply be mindfulness or yoga. A lot of this is being able to notice that you can both be frustrated and fearful, and you can do all you can to increase your well-being, such as increase your exercise, keep going to cardiac rehab, but also maybe increase the things that make you feel better. It's important to know that both can exist. You can both accept how you're feeling and commit to your values. That's what ACT is all about. So I want to close out this presentation with 3 key takeaways that overviews everything we've talked about. 1, depression is common in cardiac condition patients. This might be ranging from people who have congestive heart failure all the way to coronary artery disease and everything in between. It's important to notice your signs and your symptoms and how it displays in your life so you can make sure that it does not impact your functioning. And if it does, making sure that you get some treatment. Depression is incredibly treatable, and there are several evidence-based psychotherapies as well as medications that can help you with your symptoms. We reviewed CBT and ACT as treatments for depression, among other mental health conditions. And if you have further questions or would like clarification on these subjects, please reach out to the behavioral therapist at the cardiac rehab, or you may talk to your providers about getting linked up with a mental health professional who might do these approaches. Lastly, Please seek treatment and build skills through treatment to navigate life's ups and downs. Someone may not ever experience symptoms of depression, whereas another person might experience several episodes of major depression. What's important to know is life is hard. Life sends you things that are really difficult. Life sends you things that are really beautiful. But it's important that we're all on this roller coaster together, and that treatment and skills can help us navigate life's ups and downs so we may not suffer or struggle with depression. I hope you all are well and have a good day, and I hope you learned something about depression and coronary artery disease. Have a good day.